Thank you for joining us, everyone. My name's Mike O'Hanlon. I'm a GP based in City and Hackney, and I'm also the clinical co-director here at CEG. I've also got Krishma and Prit joining me from the CEG team. We may have some other CEG team members joining us as we go. Okay, so a bit of an overview of what we're going to cover today. So a brief introduction to CEG for people who don't know who we are, and a bit about what we do. And then it's to give you a brief update on what's happening with CEG software tools, give an introduction to the new CEG atrial fibrillation tool, and demo it so you can have a look, see how it works, and then there'll be a section for questions and answers afterwards. So who are the clinical effectiveness group? So we're a group of GPs, analysts, data scientists, and facilitators, and we are based up at Queen Mary University of London on the Whitechapel campus. We build dashboards using primary care data from across North East London, and we create searches and software tools for GP teams, NHS commissioners, and public health. We've got facilitators that provide support to every practice across North East London, and we are funded by NHS and local authorities in NEL, and also by research grants. So a bit of an overview of the clinical effectiveness approach, and today we're going to be talking about our software tools, but we also offer data entry templates to allow high quality coded consistent data to be entered in the patient record, because that's then searchable and means you can do call and recall from this and identify patients, and that ties into then to dashboards and our software tools as well. And again, we have our facilitators that offer support for every practice across North East London. So what's happening to CEG software tools? Now, some of you may be familiar with our existing APL applied patient link tools that assist practices in recall, invitations, monitoring, and optimization of multiple conditions. And we have 4 that are live currently: the APL Childhood HIMSS tool, AF tool, renal tool, and National Diabetes Prevention Programme tool. And they've been working well in practice for a number of years using Microsoft Excel, which has ensured that the tools were kind of easy to use in a format that's familiar to practice staff, because it's a software suite that every practice system has installed and everyone has been using, is familiar with using. And this is what an example of the APL AF tool has looked like. But actually, as technology and software platforms have changed, the CEG software tools are going to be evolving to take advantage of benefits of newer software technologies. And this means we can make the tools more flexible in how they function, make them more visually appealing, make them more intuitive, and just generally easier to use. So our new CEG tools are going to be replacing the APL tools. And these are browser-based, which makes them as easy to use as navigating a website. You don't need any special software installed. There's no kind of incompatibility issues around macros needing to be enabled or so on. And they've got the same familiar approach with how the APL tools work. So you run the search in your clinical system and export that report, and you bring that report into the tool. And this has the benefit of being kind of completely up to date when the search is run. And if any changes are made in the clinical system, you can just simply rerun that search, and that change is reflected in that new report. And the first tool that's going to be moving over to our new platform is the CEG AF tool. That is actually launched on Friday, so it's currently live and freely available for practices to use across now. So again, this is what the APL tool looks like, and now this is showing you what the new CEG AF tool looks like. And just again, to be aware, this is dummy data on this slide. So similar features, but a refreshed new look, and actually has some improvements in functionality that we're going to talk about then in a little bit more detail once we do the demo. So a bit actually about the AF tool. So what does it do? So the CEG AF tool allows you to work more efficiently by easily identifying patients. So it brings in all patients on your who have a diagnosis of AF coded on their notes. And it allows you to easily identify those who are at high risk of stroke or major bleeds, who require a review or medication optimization in order to reduce that risk of stroke or of major bleeding. So you can view kind of key cohorts with one click using our quick filters, or you can create your own custom filters by diving into the individual filter settings and changing options. You can prioritize which patients you're going to look at first using key metrics such as patients with your highest chance of AS scores, in order to effectively manage your workload and kind of have an efficient approach where you're kind of risk stratifying based on patients with the highest risk of stroke first. You can then drill down into that individual patient to review further metrics about them, which includes things like medications, vulnerabilities, blood pressure, other physical parameters, or test results. And then you can export a list of patients so that you can work together in a team with your practice teams for recall. So if there's a number of patients who require the same action, for example, you can ask a recaller to bring those patients in for more effective working. So I think it's really important to talk about the origins of the APL-AF tool and actually some of the impact and success that that's had across North East London. So the AF Integrated Care Pathway programme was implemented in 2020 to 2023 across some of the outer boroughs of North East London, so Barking and Dagenham, Redbridge and Havering. And it used CEG digital tools, specifically the APL-AF tool, and that enabled trained in-practice pharmacists and GPs to create baseline searches, risk stratify and prioritise patients with AF and who are at risk of stroke for review. So patients were categorised as high risk, who, if they weren't on anticoagulation, particularly if they had a CHA2DS2-VASc score. And over the course of that programme, anticoagulation rates increased from 87% to 94% in those with a CHA2DS2-VASc score of 2 or greater. And it also identified where there is potentially inappropriate dual antiplatelet and anticoagulant use, and that use was reduced by 52%. So a significant improvement in medicine safety. The tool was actually used across all 7 localities in NEL, and that resulted in NEL ICB going from the lowest performing ICB across London and one of the lowest in England to the top performing ICB within London and within the top 5 nationally within England in the year 2024 to 2025. And there's a link there to the paper in BMJ Open Quality that talks a bit about that. And this is a graph, again, just showing percentage of patients with AF who had a CHA2DS2-VASc score of 2 or greater who were on anticoagulation. You can see that figure around January 2020, sitting around the 82% mark. And by 2023, that hit 92% and has overtaken all of the other London ICBs and the national average. So that brings us on to actually showing off the tool as a bit of a live demo so that you guys can see it in action. It's one thing seeing it screenshots, one thing seeing how it works. I can talk you through it, and then if anyone has any questions, wants me to show off any specific functions, we can do that then. So I'm just going to stop sharing briefly. Okay, can everybody see the CEG website that's popped up here? Yeah. Okay, brilliant. So what I'm going to do is I'm just going to show you where you can find the link on our website. You can actually go straight to the tool as well, but if you're not sure what the link is, the easy way to find it is going to our website, qmul.ac.uk/CEG. And within support for GP practices, explore our resources, software tools, CEG AF tool, and then you can launch the tool from here. So if you click the link, it loads the tool. So the actual web link for the tool is aftool.qmul-ceg.net. And that brings you straight to the tool. But like I say, you can either just bookmark this page of the CEG website if you want to make sure you're always coming from our website to it. And this is the main launch page that you're greeted with when you see the tool. So the actual support search and report we have hosted on our resource publisher and equivalent for System 1. So you'll find it within your practice support searches. So there's no need to download a search and report, bring it into your clinical system and then run it. It just needs copy and cross into your practice domain the same way that you do for our practice support searches. You run the search and report, you export it, and then you can bring it into the tool. So I've got a report file with some dummy data that's from EMIS. So we click EMIS Web to choose our system, click Import. I don't know if you can see the browse window that's popped up, you may not, but I'm just going to browse to the report file and open it, and then our tool opens. So you can see it's got a similar kind of look and functions, kind of general functions to the existing APL tool. So it's got a familiar kind of feel to it, but actually improved appearance and much better functionality. So just before we go any further, a little bit of a word around information governance. with this being a web-based tool. So to give some reassurances, although the website is hosted by us, all of the processing that happens when you run the page and you import happens all locally on your machine. So this tool has been custom coded by our in-house team, so we know exactly how the code works, and it's been designed specifically to ensure that no patient information leaves your practice system at any time. So you can click that link to launch the tool, and then you could actually completely disconnect your laptop from the internet. You can plug it, turn the Wi-Fi off, whatever. You can still import your file and run the tool completely fine, even with your internet completely unplugged. Okay, so no processing of patient data is happening on our systems. Your patient data remains on your system at all times. So just a quick overview to give some reassurance around information governance. If anyone has any further questions, then please do just pop them in the chat. So this is the overview page. So we can see that we've got our cohort of patients. So we've got 81 patients in this data report, and we can see that they're all visible within this overview table. And you'll notice that they're all ordered by their CHA2DS2-VASc score from highest to lowest. And we talked about prioritization based on risk, and that's exactly what we were talking about. Drilling into a little bit more, I'm just going to move the Teams part out of the way so I can see a little bit better. We've got the summary view on the right-hand side here, which gives an overview of your AF register, different metrics. So those with the CHA2DS2-VASc score or more, CHA2DS2-VASc score of 2 or more, who were issued anticoagulants, issued DOACs, specifically not issued anticoagulants. So you can get an overview for your practice of what that's looking like. We then have our filter groups here. So each of these drop downs contains some filter options. So you can go through and you can specifically create your own custom cohorts. So if we choose DOAC, you see the DOAC filter is added up here, and our patient list gets filtered by that. We can look for specifically people not on an anticoagulant, and we can combine this with other filters to really bring up, those not recorded, or CHA2DS2-VASc score not recorded, and not an anticoagulant. So we can really create, our own custom code using those filtering options. However, actually, what people really want is just to be able to get into the tool and just get cracking with some really key, important, kind of high priority groups or kind of important tasks that need actioning. And that's exactly what our quick filters do. So we've got some predefined filter combinations that you can just in one click get a nice clear cohort that requires some kind of review or action. So going through these, a CHA2DS2-VASc score of 2 or greater recorded on your clinical system within the last 12 months, who are have not been issued anticoagulation in the last 6 months. And those where their CHA2DS2-VASc score, a CHA2DS2-VASc score of 2 or more was recorded more than 12 months ago in your clinical system and are on anticoagulation, and they may need a new CHA2DS2-VASc score calculating. Those with a high orbit score who are on anticoagulation. Those whose medication review was more than 12 months ago and are on anticoagulation. Those who are on NSAIDs and an anticoagulant, who may need a review to make sure that that NSAID is needed, and if it is, that they're on a PPI. And those who are on dual therapy and whose medication review was more than 12 months ago. So these patients will definitely need a review. So we've got some just quick, easy, you've only got limited time. Here are some key groups to look through without having to think too hard about combinations of filters. But if you really want to get into it and you want to tweak things, you can use the individual filtering options to really drill down and get kind of custom cohorts there. So to get actually more information, although we've got some kind of metrics for our overall population here, so we've got a CHA2DS2-VASc score, orbit score, whether they've had an anticoagulant issued within the last 6 months, an antiplatelet issued in the last 6 months, NSAIDs issued, statins issued in the last 6 months, whether they're on the CVD register, what their latest blood pressure was, and their last medication review date. We can get more information about an individual patient by just clicking on their name. And this gives us a view for that individual patient with their demographics, key medications that they're on. Now, note, this list of medications is not exhaustive, so we would always advise kind of having the clinical system open alongside for further information that may not be included in the tool. And also, if you're reviewing that patient, you're going to want to write some kind of progress note or make a request or send a task or something like that. So having the clinical system open next to you is very useful. But key medications such as warfarin, DOAC, whether they have a code for third-party prescribing, which can be the case certainly with warfarin, antiplatelets, PPIs, NSAIDs, and statins. Below this, we have then key risk scores. So we've got CHADS-VAS score, and these are all scores that are pulled from the clinical system. So they've been entered in the clinical system, and this is pulling that information from there. Orbit score and HAS-BLED scores. Then we have key comorbidities. So key ones particularly are grouped in this first row here: heart failure, CKD, ischemic heart disease, stroke and TIA, peripheral arterial disease, hypertension, and diabetes. And if they have any of these, it will flag this here, and then it will give you a list of which ones they actually have, as well as other kind of risk factors and comorbidities such as liver failure, heart failure, bleeding history, some key vulnerabilities such as SMI, learning disability, dementia, and those who are on the palliative care register. Then we have a section around process measures, which is a combination of pathology kind of results and clinical scores and physical parameters. So we have blood pressure, INR, alcohol consumption, audit and audit C scores, renal function, ALT, hemoglobin, and weight. We've then got a section around medication review. So when the code that was added for the medication review and when that was, so you can check the medication review is up to date or whether it needs to be redone. And then some key exception reporting codes. So around anticoagulants, whether they're contraindicated or they're declined, and this will show the latest ever entry for either of those two. Now you'll notice here there's this select for export option as well, and you can see on the list here we've got these tick boxes. Now what this allows us to do is say we have a particular group of patients that we're looking at, so those who require a medication review. We can go through and have a quick review and go, oh, this person, yeah, this person does need that. We can flip to the next patient. We can review their individual patient review page. And we can go through and we can make ourselves a custom list. So if we decide we don't want this patient, we don't want this patient, we don't want this patient. When we come back, we see those patients have been unselected and only the ones that we wanted remain selected. We can then export a list of those patients, either as an Excel spreadsheet, which we could then send on to a recaller or somebody else for a certain task that needs doing, or we could send it to our pharmacist to say, actually, these patients need a medication review. Can you look at those? We can create an Accurix list if there's a particular an invite just for an appointment. We can create that from there, or an NHS number list, which we can use. So particularly in EMIS, you can use to create custom lists within population reporting, and then you can do searches and reports from that list. So you can export the list that you've selected directly from this tool. We also have a link that goes directly to our user guide, which is now hosted on our website. So you can click straight through for there. So if you're not sure about anything, you can click through to there directly, as well as some key external resources, such as our website, nice CKS page around anticoagulation, and a creatinine clearance calculator on MD Calc. And when you're finished, if you want to bring in a new report, you can click load new patient data. I forgot to mention when we talk about the filters, there is also, so you get an overview of which filters are selected in this top blue bar here. So you can see at the moment, because we've selected this quick filter, we've got that they're on a DOAC or warfarin and that their medication review date was more than 12 months ago. If we add in some parameters here, we'll see these filter options change. What we can do is we can click remove all filters to remove them all, or if we have multiple filters selected and we decide we want to remove some, we can just click the individual cross on that filter to remove it. So it's nice and easy to navigate the filtering options and to create your own custom cohorts. This brings us now to our Q&A. If anyone wants to put any additional questions that they have in the chat, please do that now. What I will also say is, if you are not aware of who your locality's facilitator is and from CEG, have a look at this slide, take a screenshot. I mean, obviously, we're going to disseminate the slides as well, but do note down the contact details for your local facilitator for your area if you don't know who they are already. They're lovely, they're very friendly, they're very, very helpful. If you've got any questions, problems, queries, please do let us know, and we'll try our best to help. Okay, question from Patrick. For practice that's been following the QOF targets reports for AF, what would you suggest regarding first steps in terms of using the tool? So I think this is a tool really that you can run on a semi-regular basis, and actually is one of the key audiences for this is clinical pharmacists, and that's where the AF program actually the kind of intended audience for the program that launched in the outer boroughs was. Particularly around kind of DOAC initiation and prescribing and medication reviews. So it's really trying to find those patients that either have recently been diagnosed with AF and already have a CHA2DS2-VASc score that's high, or they have shifted from having, you know, a 0 to 1 CHA2DS2-VASc score into a score of 2, and actually then identifying those patients that they need a review. It's also around flagging patients who don't have an orbit score calculated, because it's actually not an uncommon thing. It's very, very common that patients have their CHA2DS2-VASc done annually because it is part of QOF, but actually orbit score and thinking about bleeding risk isn't necessarily done as regularly. So the tool will also flag, you know, those who haven't had an orbit score recorded within the last 12 months, and that's something that then can be actioned to generate that, and then rerun the tool to think about identifying those with a higher bleeding risk. But the other thing I would say is just run the tool, have a little look at it, have a bit of a play around with it, see what you think. It's not just for GPs to use, but for your team to use. Generally speaking, it's more for your kind of clinical staff, so GPs, pharmacists, and practice nurses, and so on. And again, if you have any feedback, if there is something you would like to see as a filtering option, if there's something you think, I would quite like to see this metric with this information here, or something you think could work smoothly, we want these tools to be used across now. We want them to be as useful as possible for everyone. So feedback's really, really important. If you have any, you think something could be worked on, it could be improved upon, or you've just got ideas, let us know. We're always happy to hear them and think about how we can implement them into our tools and services. Cannot see patients who are on DOAC and antiplatelets in 6 months. Patients who are on a DOAC and antiplatelet within the last 6 months. So that would be those on dual therapy. So there is a filtering option on the tool. Go back to this slide here. Actually, why don't I just bring the tool back up? So within anticoagulants and antiplatelets, there's this dual therapy option. So these are patients who are on an anticoagulant and an antiplatelet. So that's the one you're looking at. There is also one of the quick filter options here about dual therapy, but it is that's specifically those whose medication review is more than 12 months ago. So because there may be some patients where, for whatever reason, it may or may not be appropriate. So if you're wanting to specifically look at those where their med review is also outstanding for real prioritization about, you know, these patients need a review, then that's the one to use. Someone's got EMIS web report is not valid. Please import the correct version. So that can sometimes be if you're not exporting it as a CSV file. So it needs to be specifically a CSV file. Have a look in the user guides, because it talks through the steps that you need to do to get that report out, and then to bring it into the tool.
We do have a question.
Oh, do we have one in the Q&A?
Yeah, in the Q&A. Does the search pick up exception code?
Yes, so the search brings in your entire AF cohort. The report will pick up exceptions around anticoagulation prescribing and contraindications around anticoagulant prescribing. So when you view that in the tool, it will show you those at the bottom of the patient info page. You will also get on the overview page where it says anticoagulant issued within the last 6 months. You'll get either declined or contraindicated within there. And then when you click into that patient and you look all the way down at the bottom, you'll see the coding there. If there are no other questions, so last chance to pop a hand up if you have a question. Otherwise, I think we'll bring things to a close. Brilliant. All right. Well, thank you for joining us, everyone. I'm really keen to hear thoughts and feedback around the tool, things you think might improve the tool, make it more useful for you. So if anything like that is, you have any thoughts or suggestions, please do just drop your facilitator an email, and they'll pass those on to the development team, and then we can look at how we can implement that into future versions. Similarly, if you're having any problems accessing the tool, running it, or problems or queries, please do just reach out to your local facilitator who can help and support you with that. All right. Thanks again, everyone, for joining, and take care, and hopefully see you soon at the next one. Thanks. Bye-bye.